All right, well, you know it is October, and October means it is Breast Cancer Awareness Month. Genetic testing plays a big role in identifying an inherited risk for breast cancer, but that journey can be pretty concerning and sometimes frightening if you have to go through those tests and not know maybe what the results are going to be. Well, our own Megan Woods decided that she wanted to go on that journey because of the history of breast cancer in her family, and she wanted to chronicle the story for us. Go ahead and take a look.
There are so many times where we're super personal. We ask personal questions. We meet people on their worst days, and we ask them to open up. But I guess I never really took the time to recognize, there are times where we have to do that for ourselves, and I am a little nervous. So, my name is Megan Woods. I am 29 years old, and I am doing genetic testing. I want to see if I have this BRCA gene mutation. We made an appointment, which is half the battle, but then they want me to fill out, I don't know if I can show you, all of this family history, and it's thorough. And they were asking me questions that honestly I don't have the answer to. So I recruited some heavy duty help, my mom. And thanks, Mom, for helping me.
Yeah, it helps me too.
It took a lot of digging, phone calls, and uncomfortable conversations with loved ones. Did you ever have colon polyps? What cancer is stripped away from my family is a touchy subject. Both of my grandmothers had breast cancer and beat it when I was a young girl. Too young to understand. It was like as a little kid, you're going through drawers and stuff like that, and you find like a bra that one side has like stuffing, or I don't know what you would call it, and then the other one is a regular bra. And so as a young girl, you're like, what is going on? Like, what is this, Grandma? But in high school, when my mom's mom, my Grandma Johnson, had to face breast cancer again, I understood why no one talked about it. Cancer had spread to her lungs, spine, and brain. I was by her side, driving her around, bathing her, and I saw her scars from procedures and treatments for what they were, battle wounds. It's heavy. And so thinking back to all the things that she dealt with, having to see that and just worrying about, okay, that's a possibility that I could have it. My Grandma Johnson died in 2010. 13 years later, getting tested for the BRCA gene mutation isn't just about results for me. It's become about healing, too. I think that she would be proud that I'm not afraid. Because she went through so much, and I know even my other grandmother that's here today, she's been through so much, and I think they don't want me to go through that same thing. So if this could prevent that, then I think they would be proud.
We're almost there. How you feeling?
Nervous. It's one thing when you're like doing an appointment like this, it's your first time, but then you have cameras in the back, you have your
an entourage.
Yes.
An entourage.
Yes.
Here we go. Great. Hello, Megan. How are ya?
Good. How are you?
Good.
At Corewell Health in Royal Oak, I met with a genetic counselor first. She explained the test.
We can use this information to help take care of you better, so we can do things proactively. If we know you were born with an increased risk for certain cancers, then we could increase your screenings and things like that. Then I met with Dr. Dana Zakalik, the director of the Cancer Genetics Center, who took interest in what previous doctors would brush off.
Had your mother ever been told that she should test because her mother has
I don't know, because when I first told her about a story I did about the BRCA gene mutation, she didn't even know what that was. She says that's not uncommon, especially among Black women like myself.
Amongst Black women, breast cancer tends to be more aggressive. It gets diagnosed at more advanced stages and tends to have a worse prognosis. We try to calculate women's risk of breast cancer based on hormonal factors and family history, and that I don't believe is being done as commonly for Black women as it is for other women.
There were times I got emotional.
I'm sorry. So I came in just because my grandmother, my father's mom, and my mom's mom, and just finding out all this other stuff that I didn't know is really overwhelming.
Yeah. It can be overwhelming. We're going to We're going to walk you through this.
But the experience quickly became empowering.
This gives me a fighting chance because I feel like there were times where I felt like my grandmother didn't stand a chance.
You're an ambassador for your whole family, really.
You're standing, here you go. Yeah. You go ahead and hold it in there.
The test itself is a simple blood draw. Then it's sent to a lab to be processed. Walking out the hospital, I felt relieved and ready for what came next.
I just think that I thought I was doing this to help viewers, help myself, but I didn't realize it was going to help my parents. I didn't realize the difference this really makes.
After weeks of waiting, it was time to call and get my results.
So I'm here at the station with some moral support, my dad.
Beaumont Cancer Genetics, this is Alexis.
And as I held my breath, we found out.
And good news is that you did not come back positive for any of the genes.
A relief years in the making, and not just for me.
Yay!
Yeah.
I know, it's not.
Trust God, our faith.
Yeah.
It's such a beautiful story and really such a personal one. We thank Megan so much for sharing that with all of us. And I know that she has received so many emails from people saying, gosh, this has made me start to ask questions about my family history and look into genetic testing as well. So genetic testing is one thing when we talk about trying to see if we have that predisposition for breast cancer, but there are other ways that we can kind of mitigate the risk in our lives. Megan talked with Dr. Maureen Anderson. She is the medical director of integrative medicine at Corewell Health about some other things that we can take into consideration.
So, Dr. Anderson, when we're talking about the risk, whether you take the testing to see if you have this mutation, or if you just want to know, there are ways to give yourself a better chance and take those preventative steps.
Yes, that's absolutely correct. And the good news is that the strategies you use to prevent breast cancer are also helpful in preventing cognitive decline or cardiovascular disease or things like that. So you don't have to pick just one. The same nutrition and exercise, etc., recommendations will help your health overall.
And so what are those steps, or is that what people do when they come to your office is, kind of navigating or breaking down what's best for them and their risks?
Well, so we do have the resources to meet with people who are concerned about developing cancer. They might have a family history or the gene. And we also support people who have had a diagnosis and they need support going through treatment and recovery and into the survival phase. But we have a naturopathic physician who does only oncology. So he knows all the latest studies on natural and nutritional strategies to support health and to decrease risk. But in general, what we know from the Predimed study and the Leon study, that the Mediterranean diet is protective and there's decreased risk with that. And so what does that consist of? Of course, lots of good vegetables and some fruits, some healthy fats such as olive oil, nuts, chia seeds, hemp. Flax is very good in the breast health realm. Ground flax or regular flaxseed rather than flax oil is a little bit better. And then we come to the issue of protein, because we know that protein is important. And so the type of protein makes a difference. Soy is actually protective and decreases breast cancer risk, especially in premenopausal women. But we have many people asking the question, well, what about, I have breast cancer, is soy going to be a problem? It's a phytoestrogen. And what the studies have shown is it's not a problem, it's not a benefit, but you can continue to eat soy afterward, but it's most protective before diagnosis. So that along with legumes, nuts, those are all good sources of protein. Fish, chicken, eggs, all fine. Where we get into, some controversy or some question is in the red meat and processed meat department. Processed meats are pretty clearly a no for if you want to be healthy overall. And so that's lunch meat or deli meats, it's hot dogs, it's sausage or bacon, things like that. Red meat, there is some controversy, but in general, the recommendation is, less is better. There's plenty of other protein sources and other ways you can meet your needs.
So all the good stuff.
Yes, right.
All the tasty stuff you have to watch.
Right. And speaking of that, another kind of unpopular one is alcohol, because alcohol is a risk factor for many cancers, including all the ones of the digestive tract, from the mouth all the way down to colorectal. And it's a big risk factor for breast cancer. So people are wondering, well, how much can I drink? And it depends on who you ask. If you ask the World Health Organization, they'll say there's no amount that's safe. Others will say, oh, maybe, 2 to 4 drinks per week, not all in one day. But so again, just like the red meat thing, less is better. I think that's the general guideline. Now you can substitute green tea, which I know may not be as fun, but it is protective. There's a lower risk of breast cancer in those who consume green tea.
All right, and Megan is going to have an entire special about genetic testing and all the things that you can do. That's going to be streaming on Local 4 Plus very soon, so look out for that.